with my patient, Tim.
Oh, wow.
You have back pain and ankle pain?
Yeah.
Okay. You started 2 days ago?
Mhm.
Did you do anything in particular that caused it to start?
Running?
You're running?
Yeah. My back was hurting because I did some, like, I was at the gym.
Okay.
So it could be just sore.
Is it lower back or mid back?
When I'm sleeping, it's kind of like, it's spotty. So
Okay,
it goes
like
up.
throughout?
Yeah.
Okay. And it's a sharp pain?
Yeah, it's just like an annoying pain. It's not like I'm like dying or anything, but
Okay.
yeah.
You've had injuries in the past?
Yeah. I had double leg surgery. I was in a wheelchair.
Really?
Yeah.
You had leg surgeries?
Yeah. My femur bone.
You had your femur operated on?
Yeah, look. See the scars?
Oh,
Yeah, no, I was in a wheelchair for a little bit.
I didn't know.
So,
Okay.
like 5th grade and 6th grade.
Okay, we'll do an exam and then can you bend down and touch your toes as much as you can? Is there any pain with that?
This hip wants to go that way.
Okay.
So,
And then if you lean backwards, any pain with that?
it's just tightness.
And then if you twist, any pain?
No.
And then if you side bend, no pain?
No pain. Again, it's just like that hip that's like kind of like trying to move on its own.
Okay.
So,
We might
like,
have to do some like rehab,
I've been doing that. Like,
but we might have to strengthen it actually.
yeah.
Okay. If you want to take out anything in your pockets, because I'm going to have you lay down.
Sure. Lay down.
Lay face down.
Okay, Tim, get on the ground. All right, cool.
Just let me know if there's any pain with any of the tests that I do.
You know what I mean?
Is there any pain in your back with this?
No, just like stretch movement.
Yeah, you have to stretch.
Yeah.
Use this and do some drops. Can you see everything? Let me just make sure. You did?